I'd like to welcome everybody to today's presentation on mind-body strategies for living with chronic illness or addiction. I'm your host, Dr. Elise Snipes. Today, we're going to discuss how sleep, circadian rhythms, hormones, anti-inflammatory diets, improving the microbiome, getting movement, pain management all can help people improve their quality of life when living with chronic illness or addiction. We may not be able to, or doctors may not be able to cure the chronic illness. And people who are in recovery from addiction may be enduring ongoing pause. And in addition, if you are in recovery from addiction, if you are stable in your recovery, that's wonderful. But if you start experiencing stress in one or more pieces of life, that can be a relapse trap. So recognizing, hey, I have an addiction or I had an addiction and it's in remission right now, but I certainly don't want it to come back, is really important. I'm going to talk a lot today about focusing on the acceptance and commitment therapy concept of living in the and. Saying to yourself, I can have, fill in the blank, this chronic illness and move toward a rich and meaningful life. Just because I have a chronic illness doesn't mean I cannot do anything. Now, some things may have to be modified. True. However, we can use our energy to move toward that rich and meaningful life instead of feeling like the symptoms or the issues or the diagnosis is in control and telling us what we can and cannot do. The physical impact of chronic illness or addiction is significant. And let's talk about why. Physically, when we have chronic illness, it's stressful. And it can be stressful because something's going on in our body that's keeping the machinery under the hood, if you will, miscalibrated. So we're not as efficient in what we do. It can be stressful because we're not sleeping as well because of pain. When we have stress, more often than we have relaxation, our stress response, our sympathetic nervous system, can get too strong. And our relaxation response, our parasympathetic nervous system, can get too weak. So we have difficulty turning off our stress. We have difficulty down-regulating, relaxing, whatever word you want to use. When we have difficulty relaxing and we stay in a stressed state, even if it's, only a minimally stressed state, but we're in a stressed state, our autonomic nervous system alters its balance, and we start to see that cortisol, our stress hormone, loses its ability to suppress inflammation. We start to see changes, not good ones, in our gonadal hormones, our thyroid hormones, in our sleep quality, in our neurotransmitters. So definitely we want to look at how can we reduce stress in each piece of our life: physical, interpersonal, emotional, cognitive, and environmental. How can we reduce stress, unnecessary stress, in each area of my life? And how can I mitigate or deal with inevitable stress? Because, crap's going to happen. And we want to be able to recognize that I can have a chronic condition, I can be faced with a stressor, and I can effectively use my energy to handle it in a way that helps me move toward my rich and meaningful life. So ANS balance, our autonomic nervous system balance, is kind of the umbrella for most of this, because when our autonomic nervous system gets out of whack, everything gets out of whack. We see inflammation. Inflammation may be caused by stress. It may be caused by the disorder itself. If somebody has an autoimmune condition, then stress can cause their immune system to go kind of haywire, and they start having more inflammation, more pain. And we need to recognize the bidirectional impact. Stress triggers the stress response, increases inflammation. Inflammation, the body says, hey, that's a stressor. Guess what? That triggers the stress response and increases inflammation. Now, that system doesn't really seem to work very well, but that's the way we're wired. Physically, when we have chronic illnesses, It impacts our circadian rhythms. It often impacts what we do, how long we can do it. We have some days that are good days, some days that are bad days. We have some days where we're wide awake and some days where we feel like we can barely get through the day and we need multiple naps. Unfortunately, when our circadian rhythms get dysregulated, it negatively impacts the autonomic nervous system because some of the hormones that are regulated by the circadian rhythms also help regulate the autonomic nervous system. Sleep quality, well, if circadian rhythms are out of whack and we're stressed out, we ain't going to sleep well. Plus, if we've got pain, we're not going to sleep well. Hormones and neurotransmitters, and I'm just going to lump these two together because they work as a team, they get out of balance. And whether it's because of the condition like polycystic ovarian syndrome, or it's because of stress, as our hormones get out of balance, it generally worsens the chronic illness. PCOS is highly, highly, highly correlated with chronic stress and trauma. People who have a dysregulated autonomic nervous system often have imbalanced gonadal hormones, which affect their reproductive system. Gut health. When we get stressed, our body calls in a whole different group of microbes to produce what it needs to produce in order to help us prepare for and sustain that fight or flight reaction. When this happens, then we start seeing the relaxation microbes, if you will, the positive microbes, I don't know what you want to call them, they start getting lazy, they start disappearing. The environment becomes inhospitable to them. They don't want to be around all that stress. And when our gut is unhealthy, then it sends signals via the vagus nerve to the brain saying, danger, Will Robinson, there's a problem, we're under stress, we're under attack, which again triggers that stress response, increases inflammation, yada, yada. Blood sugar regulation when we're stressed because we're not getting enough sleep, because our microbiome's out of whack, because we've got inflammation, it causes spikes in our blood sugar. Likewise, spikes in blood sugar cause stress, and we need to regulate these things. The more we can regulate our stress, the more we'll be able to retrain our autonomic nervous system, the more we'll be able to help our body effectively suppress unnecessary inflammation, the more we'll be able to regulate our circadian rhythms. And energy and pain levels are also impacted by all of these things. If you're not sleeping well, if you're in pain, if your hormones are out of whack, if your neurotransmitters like dopamine and glutamate are out of whack, then you're not going to have as much energy. Norepinephrine is our focus neurochemical. If that is deficient, then we're not going to be able to focus as much. And I've said in many other classes, when any one of those neurotransmitters or thyroid hormone or gonadal hormone gets out of balance, all of its buddies go in tandem with it. So there's a different balance of neurotransmitters when we're under stress than when we're not under stress. I didn't mention addiction as we went through this because I wanted to try to make it as concise as possible, but let's go back through that. When people are in active addiction, they are often very unhappy. When they're using, they may be numb, they may be happy, but when they are not using, when they're in withdrawal, then that's a big stressor. When they use, a lot of times they're ingesting a toxin. That's a stressor. When they are using like behavioral addictions, we'll take porn addiction, for example. When people are engaging in compulsive pornography use, it alters the balance of the stress hormones and the gonadal hormones like testosterone and causes the brain to go into a stressed state. We need to recognize that addiction, both using and withdrawing, is stressful. So every time the person uses or withdraws, they're triggering that stress response, which as I mentioned earlier, will lead to the body's inability to suppress inflammation. And because of especially substances, you may see increased inflammation in the gut, in various tissues. Circadian rhythms are often messed up because we go to sleep partly based on our circadian rhythms. Cortisol's highest in the morning, gets us out of bed. It's supposed to decrease throughout the day. If it doesn't decrease because we're stressed, then melatonin doesn't get secreted. And if melatonin doesn't get effectively secreted, we're not going to have good sleep. A lot of people, not all, but a lot of people with addictions don't prioritize sleep either. And so they may stay up gambling into the wee hours of the night or whatever, playing video games until 2, 3, 4 in the morning. And then, oh crap, I got to go to work at 6. We see as a result of the stress on the body and the imbalance in the autonomic nervous system, people with addictions very often have imbalances in their gonadal hormones, testosterone, estrogen, progesterone, and to a certain extent, oxytocin. We see imbalances in neurotransmitters because their dopaminergic system has been going in overdrive, which means all of the other neurochemicals are kind of out of balance because one of their components is basically, for a lack of a better explanation, basically used up. So there's this gap. It's trying to make chocolate chip cookies and not having any eggs. There's a gap there. What are you going to use to hold everything together? Gut health. Well, if you're ingesting stuff, then certainly your gut health is going to be impacted. But remember that a lot of substances are not ingested orally. They can be smoked, they can be injected, they can be taken in many, many different ways. So it won't necessarily always directly contact the gut microbiome, but the stress caused by use directly impacts the gut microbiome, which directly impacts the stress response. Blood sugar regulation, when people are getting their rush, when they're getting their high, their buzz, whatever they're calling it, that's a stressor. It's exhilaration, but it's a stressor. And so they're going to have a spike in blood sugar. And when they detox, when that substance leaves their system, their body recognizes it as a stressor. So they're going to have another spike in blood sugar. All of these spikes in blood sugar, poor energy, or poor sleep, etc., is going to impact energy. And as dopamine becomes imbalanced, the body's ability to, and stress becomes prominent, the body's ability to manage pain actually goes down. When we get stressed, we actually have a lower pain tolerance. And I have other videos that talk about why that is. My point is, our body, if what's going on under the hood ain't healthy, then it's going to worsen the addiction. It's going to potentially trigger a relapse in the addiction, and or it's going to potentially worsen or trigger the onset of an autoimmune disorder. Can we help somebody completely get rid of these things? Probably not. There's a lot of people in the addiction community that say it's a lifelong condition that you live with. Some people call it a disease, some people call it an illness, call it what you want. Autoimmune disorders, so far, to the best of my knowledge, they haven't found a way to cure them. But we can figure out how to help people live their highest quality, most meaningful life, and have these conditions. So we're going to talk about a variety of those issues that we just mentioned, and most of today's presentation is going to focus on what to do. And I'm going to be doing less of all the science-y stuff underneath. First thing, we need to help people balance their autonomic nervous system. We need to help them strengthen their parasympathetic response. That's that relaxation, rest, digest, repair. Strengthen that and help them regulate or be able to down-regulate their stress response. When people are chronically stressed and cortisol loses its ability to do what it's supposed to do, we start to see a condition called hypocortisolism. And in other videos, I've talked about the flat to the furious. And people who have an imbalanced autonomic nervous system emotionally dysregulate. That's a common term that a lot of people use. They go from flat to furious or flat to frantic. And there's no middle ground. It's not, I'm just going to be a little irritated. I'm either flat or, fine, or I'm really ticked off. There's no middle ground. That is not just somebody being dramatic. That is the result of an imbalance in the neurochemical response to the stressor. As people spend less time in the stress response and more time in that relaxation area, they will start to have a more balanced response to stressors, which is wonderful, but it doesn't happen overnight. It doesn't even happen in a month. We want to help them look for reductions in the frequency, intensity, and duration of their dysregulation. When you get fired up physically, what's going on? When your heart rate's beating rapidly, when you're breathing rapidly, you're sweating, all those physiological symptoms of stress. We want to see the intensity reducing. We want to see you staying in that state for less time. Your ability to manually override the stress response becomes paramount. And we want to see frequency, intensity, and duration. And we want to see it happening less often. Instead of 5 times a day, maybe get it down to 3 times a day. That's almost half. That's pretty darn good. We're not going to stop there, but encouraging people to focus on progress, not perfection. If they're still having episodes 5 times a day, but they are less intense and don't last as long, that's progress. And helping them really recognize that is important, because the things that cause them stress have been sort of ingrained in their core beliefs and their expectations. So it's going to take some time to reprogram that. And we're going to talk about some of that stuff in future videos. So we want to reduce the frequency, intensity, and duration of time spent in fight or flight by reducing unnecessary stressors and mitigating unavoidable ones in each piece of life. Have people write down I usually use 5 different pieces of paper or a spreadsheet with 5 columns: physical, interpersonal, emotional, cognitive, and environmental. And then under each one, what stressors do I have in this area? And it can be physically. It can be anything from pain, hunger, difficulty regulating temperature, sensitivity to noise, sounds, light levels, whatever it is. What are your physical stressors? Allergies, a physical stressor. What can you do about them? Which ones can be eliminated? Because, hey, if you have difficulty regulating your temperature, which I know I do, I have fans. And when I start getting too hot, most everybody else isn't too hot yet, so I'll turn on my fan. I cool myself off. And that helps me reduce that distress. So my stress response can go back down. It can say, okay, she's got it covered. For the unavoidable stressors like allergies. All right, I've got allergies. I've got allergies to cats and dogs, but I'm not willing to give up my cats and dogs. So what can I do to mitigate that stressor? And one of the things is frequently changing my sheets, not letting the cat sleep on my pillow. Those are things that I can do. Is it going to make that stressor completely go away? No. But it's a compromise that is reasonable in my rich and meaningful life. Because in my life, my perspective of a rich and meaningful life has animals in it. And I'm not willing to give that up. Have them do that for each piece of life. What things are unnecessary that there's a relatively easy fix for, what things are unavoidable, but you can develop a strategy to manage it so you feel more empowered to manage that stressor. Just having a plan a lot of times can help reduce the stress. If I know that I'm going into this meeting with somebody who typically is passive aggressive or nasty, I recognize that ahead of time. I've got a plan for how I'm going to deal with it so I don't feel so vulnerable when sort of the inevitable happens. And so I felt less stressed going into that meeting. That's one way that people can feel empowered. And obviously, eliminating those unnecessary stressors means you're not spending energy getting stressed out about stuff that you didn't have to get stressed out about in the first place. All right, so enough on that one. Practice parasympathetic nervous system regulation exercises. That means strengthen your vagus nerve. High intensity interval training can work for some people. Not everybody want to do that, and not everybody is in the condition or has the energy or mobility to do that. That's fine, okay? We can look at biofeedback. Biofeedback, the easiest way to monitor it is to get a chest strap, Polar H10 chest strap. You can get it off Amazon. It's the one that has been deemed to be the most accurate of the non-medical heart rate monitoring devices. You can get the really expensive ones from the doctor that are thousands and thousands of dollars, but who has that kind of money? The Polar heart rate strap does a really good job monitoring your heart rate pretty much in sync with what's going on with you, maybe 2 or 3 seconds off. My Garmin is usually about 45 seconds to a minute and a half off. So that is not a good use of technology for biofeedback, because biofeedback, you get up, you walk around, walk up and down a couple of stairs, or do whatever it is you do that increases your heart rate some, maybe 10, 20 beats a minute, and then practice slowing your breathing and engaging whatever distress tolerance skills work for you to get your heart rate back down, to get your breathing slowed, to be back at that baseline, whatever it was for you. So for example, my resting heart rate's somewhere around 52 beats a minute. When I walk upstairs after going down to get coffee or something from the kitchen, when I walk upstairs, my heart rate's, mid 80s or something, because I had to walk up those daggum stairs. I sit down, I look at my chart, my Polar, and I see how quickly, because I make a game out of it, how quickly can I bring my heart rate back down to baseline. You can do the same thing with blood pressure, but again, there's a little bit of a delay there. So doing this can be really helpful to strengthen the autonomic nervous system and make you more aware of what it feels like when you're stressed versus when you're relaxed. Some people, and I don't have it on here because for people with trauma histories, yoga may not be ideal for them. There is trauma focused yoga, but that's a whole different animal. If you are comfortable focusing on full body physiological sensations, you can practice with yoga or even stretching. You stretch, you hold, and you breathe through the pain, basically, because when you're stretching, there's a little bit of discomfort. And if you tense up, it's going to last longer. If you slow your breathing despite feeling discomfort, your brain goes, what the heck's going on here? I guess there's no problem. And then you start to relax some. So yoga or stretching can also be incorporated. Improve your distress tolerance skills to activate your parasympathetic nervous system, your relaxation, and your vagus nerve. Your vagus nerve is your main parasympathetic nervous system freeway, if you will. So strengthen that vagus nerve. There are a lot of different things you can do, from singing to chewing gum. You have a lot of nerve endings on either side of your face that attach to the vagus nerve. So when you're chewing or speaking, many times it triggers that relaxation response. Now, obviously, if you're screaming at somebody, that doesn't work. But blowing bubbles can help you slow your breathing a lot. And a lot of us as adults quit chewing bubble gum. But hey, if you're one that tends to have a lot of stress, chewing bubble gum may be helpful if you don't also have TMJ. These things are strategies you can take to actually target strengthening that parasympathetic response, giving the person, empowering the person to manually override that stress response and say, I don't need to be stressed right now. I don't need to run. I don't need to fight or flee right now. So I am going to turn down that stress response so I can conserve that energy for things that are important in my rich and meaningful life. Inflammation. I mentioned earlier that when the autonomic nervous system gets out of whack, we are going to have systemic inflammation. That's just the way it happens. Inflammation can be caused by exposure to toxins, and we know there's a lot of toxins in our environment. Injury, when you break your arm, guess what? It swells. It's what it's supposed to do. All right, not a problem. Bacteria or viruses. I just got over food poisoning a couple of weeks ago. Oh my gosh, that was wicked. And my guts felt like they were totally inflamed the whole time. And it was painful, obviously. But it can be caused by, exposure to those things. We can work on our hygiene, work on our food hygiene. We can reduce our exposure to toxins as much as we can. Obviously, being careful so we don't get bad injuries, that's helpful. Those are unnecessary stressors. And then just reducing that overall stress. Anything that's causing stress in any piece of your life. You can't eliminate all of it. I know I'm going to keep saying that because I'm going to have somebody in the comments go, well, I'd love to have your life where you're not stressed. Well, I'm stressed, but I choose what I use my energy to address. And I choose when I'm faced with a stressor, I ask myself, is this a good use of my energy to dwell on this, to address this, to whatever? Is this a good use of my energy to help me move toward my rich and meaningful life? If the answer is no, then I say, all right, what else can I do? Because I don't want to steal energy from the people, things, and experiences that are important to me to give to something that really doesn't matter. In order to reduce inflammation, reduce your exposure to toxins, airborne toxins like smoke and whatever else is in the air. Alcohol, it's a toxin. I'm sorry, it is a toxin. When you drink it, your body goes, oh, maybe we shouldn't have this in our system. Drugs, that can be prescribed drugs and illicit drugs. They are toxins. Now, sometimes you need to take them. I get it. But recognizing their impact on you. A lot of us, if we take NSAIDs like ibuprofen for more than a day or two, we start getting inflammation in our gut. Our gut starts feeling like it's on fire. And that's inflammation. Are there alternate things we can do besides taking that particular drug to address whatever's going on? And phthalates, and I know that's not how you pronounce it, but I can never pronounce it right. But those things in plastics, we want to avoid some of those endocrine disruptors that are out there. Use glass, use BPA-free plastics if you have to use plastics. Try to reduce your exposure to insecticides, pesticides, etc. Those are all great for reducing inflammation. Obviously, reduce your stress. When you're not chronically stressed, then your stress response starts working again. And cortisol starts working again. And when cortisol works, it is a powerful steroid. It is a powerful anti-inflammatory. Reduce body fat. And I know that's not a popular thing to tell people, but ultimately we know the more body adipose tissue you have over a certain level, we need some, the more adipose tissue you have over a certain level, the more estrogen that's expressed in your body. And this is true for people of all genders. Adipose tissue is the fancy way of saying fat tissue. Reducing body fat can help with inflammation if you've got excess adipose tissue. Eat colorfully. Antioxidants and terpenes. I'd always thought of terpenes as those things that you smell. And typically that's what we're talking about is terpenes are in essential oils. Terpenes are in certain herbs that you may ingest. And they're wonderful. But terpenes are also just chemicals that are in the foods that we eat. And terpenes have been found to have anti-inflammatory effects when they're ingested. Regulate your circadian rhythms. This means, well, I'll get there in a minute. When you regulate your circadian rhythms, it helps regulate your hormones. Women know that during their younger years, they're on a cycle. And that cycle may be 28 days, it may be 30 days. People who have a lot of stress tend to have very irregular menstrual cycles. Part of that is because the circadian rhythms are out of whack. Circadian rhythms regulate our gonadal hormones, our sex hormones. They regulate our appetite hormones, hunger and satiation. They regulate our sleep hormones like melatonin. They regulate neurotransmitters, which when hormones are in the right balance, it's going to help our neurotransmitters be more bioavailable and in the right balance. They work synergistically. So hormones impact the availability of neurotransmitters. And regulating your circadian rhythms also helps reduce stress. I know, imagine that. When you are telling your body we get up at 6 a.m., then your body knows that roughly at 6 a.m., that's when cortisol is supposed to spike. And when your body gets used to the fact that we go to bed at 10 p.m., then it starts recognizing that pattern and secreting hormones appropriately, so you are getting sleepy. You're secreting melatonin and getting sleepy around bedtime. When your cortisol is doing what it's supposed to do, it's going to help your hormones be in balance, and it's going to help your neurotransmitters be more in balance. How can you regulate circadian rhythms? It's not just about light levels. Your daily routine. If you recognize, my son, when he was little, I could set my clock by him. And he would wake up at the same time every day. He would get hungry at the same time every day. At 2 o'clock, he would lay down and he would take a champion nap. But as an infant, his circadian rhythms were very stable. And when we eat, helps our body figure out kind of what time of day it is, especially in today's world where in the middle of the night you can be in a bright room, or in the middle of the day you can be in a really dim room. Our body isn't as aware of what the actual light levels are outside. Keep a regular routine as much as you can. Get to sleep about the same time each night as much as you can. Regulate when you eat, and that goes into your routine. Manage your light levels. When it is daytime, when you're supposed to be awake, try to keep it as bright as you can tolerate it. That doesn't mean you have to be, in a glaring room, but try not to be in an environment in which you've got like 25 watt bulbs shining. You want to have it so it is bright and your brain says, hey, it's time to be awake. Likewise, when it's time to go to sleep, preferably 2 hours before, reduce or eliminate that blue light. On the phone, on the computer, on the television, yes, you can get a filter that filters out some of that blue light if you like watching TV right before bed. Practice good sleep hygiene. We're going to talk about that more in a minute. And avoid excessive caffeine or stimulants. I know some people are not going to give up their caffeine. I'm not. I can only have 1 or 2 cups a day now, but I really cherish those 2 cups. Avoiding excessive caffeine, especially within 8 hours of bed, is really important. And stimulants, some of them have different half-lives, like nicotine. You want to avoid 2 hours before bed. But basically, try to avoid things that are going to keep you awake. Poor sleep, which can be caused by disrupted circadian rhythms, and it disrupts your circadian rhythms. But poor sleep contributes to fatigue, irritability, brain fog, difficulty controlling negative thoughts, and yes, stress and inflammation. Because fatigue, irritability, brain fog, and negative thoughts are all stinking stressful. Sleep hygiene, as I mentioned earlier, have a routine, but have a wind down or a relaxation routine that you do at the end of your day. You come home, you get changed out of your work clothes, you eat dinner, you do something to relax, maybe you take a shower, then you go to bed. Try to be consistent in the times that you awaken and go to sleep. We sleep better when it's cool. 68 to 72 degrees is what they say. You want to use warm, dim lights 2 hours before bed, about 2,500 Kelvin. That's almost like candle glow. And I say dim. When you're talking about incandescent lights, it would have been like a 25-watt light or a 25-watt equivalent if you're using LEDs. But really dim lights. It's enough to get around. You're not going to stub your toe because you can't see anything. But it's also enough that your brain's starting to say, oh, probably not the best time to read. You want to sleep in darkness, and that includes blocking out the full moon. Sleep in darkness as much as possible. If you feel comfortable wearing a night mask, great. Have no noise, so it's a quiet room, or use white or pink noise. I find white noise annoying because of it's balanced across all levels of the sound spectrum. And the high pitches really bug my ears. I've got tinnitus anyway. So I don't like white noise. But pink noise is more like waves crashing or leaves rustling. It tends to focus on some of the lower tones in the musical scale or whatever. But they found that pink noise actually helps a lot of people relax and sleep better. And they have shown that it also increases the release of human growth hormone. Who knew? Reduce allergens and what I call awakeners. Anything that's going to wake you up in the middle of the night, whether it's the dog getting up and changing its position, or you got to pee 3 times, or your spouse steals your covers, or you've got kids. You obviously have to tend to your kids. I'm not saying ignore your children. But when my children were little, my husband and I would take turns. When they were very little, my husband was on midnight shift, so he would take the night shift with the baby so I could get sleep. And that was essential for me, not only because it helped with circadian rhythms, but I had wicked postpartum depression, and it helped me better regulate that. Address sleep apnea. If you stop breathing when you're sleeping, guess what? That's stressful. And you're also cutting off or reducing oxygen to your brain, which is going to contribute to brain fog. And all of that is going to register as a stressor, which is going to increase inflammation. No caffeine within 8 hours of bed. Go to sleep when you have a blood alcohol concentration of 0.00. Notice I didn't say don't drink at all because a lot of people aren't willing to give that up. However, make sure when you're going to sleep, your blood alcohol is 0.00. And no naps longer than 30 minutes. When you go longer than 30 minutes, you start getting into REM sleep, which really freaks your circadian rhythms out because they're like, okay, is it actually time to sleep now? So you want to stay in that light sleep phase, no longer than 30 minutes. There was a meme I saw a couple weeks ago about pulling an all-dayer and how proud somebody was that they had done it. And, so I said, I pulled an all-dayer without coffee or a nap. But you see in that picture, there's crazy expression going, all right, just try me, and folded arms. Because when we're not getting enough sleep, when we're not getting quality sleep, then it tends to trigger that stress response. So we're already stressed out, and it doesn't take a whole lot to really send us into the stratosphere. In terms of hormones, both thyroid and gonadal hormones, when your stress response is out of balance, it's going to negatively impact your gonadal, your sex hormones, and your thyroid hormones. Stress negatively impacts all hormones, including hunger, sex, and thyroid. Interventions, guess what? Reduce stress to reduce inflammation and improve hormone balance. Basically, stress is sort of like an imp that's going in there and just messing with the balance of everything. And we want to get that imp out of there so your body can stay calibrated. Improved hormone balance is neuroprotective and helps regulate neurotransmitters. Talk with your doctor about regulating your hormones, whether that be through bioidentical hormones or exercise or whatever they suggest. As we get older, we reduce the amount of gonadal hormones we're making, and that also negatively impacts the availability of our thyroid hormones. When people are able to try to get those back in balance a little bit, they notice a significant improvement in energy and the aches and pains and healing properties. Get blood work at least once a year to monitor your hormone levels. Between you and your doctor, what you're going to do about that. And increase oxytocin, the bonding or survival hormone, which is anti-inflammatory and is a powerful regulator of the autonomic nervous system. You only want to increase oxytocin in environments in which you feel safe and empowered. If you try to increase oxytocin in an environment in which you're afraid, mama bear is going to come out. Excuse me. And when mama bear comes out, that's a stress response. You're gonna roar at whatever that stressor is. And that's not what we want. But oxytocin, when you're feeling safe, can help you downregulate, can help you activate that parasympathetic nervous system. It helps reduce inflammation, and through its secretion, does actually help regulate the autonomic nervous system. Blood sugar regulation is another biggie. Insulin resistance is not just caused by eating. Yes, our blood sugar goes up when we eat, but our blood sugar goes up every time we're stressed. Most people, unfortunately, I think it's like 75-80% of people in the United States have some level of insulin resistance, even if they're not overweight, because of our chronic stress. When people develop insulin resistance, it increases systemic inflammation. It's what happens. We need to reduce our insulin resistance. We need to reduce the frequency that we have those blood sugar spikes. How do we do that? Intermittent fasting is one. Now, 12 eating window of 12 hours and a no eating window of 12 hours, that's fine. That's a lot for a lot of people. Some people find a off window of 14 to 16 hours with a much shorter eating window more helpful. Whatever you start doing, your circadian rhythms are going to adapt. It takes a minute, and don't do it too quickly. Don't decide, hey, I'm going to try that, and I'm going to try for 16 hours without eating. You're going to be hangry, and that increases stress. What I do is I eat my last meal at a certain time during the afternoon. And then I know by the time I get up the next morning, it'll have been 12 hours since I ate. And so I've got the minimum in. And that helps me because I like to eat breakfast first thing in the morning. Keep consistent meal times. That helps your brain know when it's supposed to be getting food and secreting blood sugar. Focus on distress tolerance and down regulation to reduce cortisol-related sugar spikes. Each time you get stressed, your body is dumping, think about it as dumping like a bag of M&Ms. You don't need all that sugar in your body. Decide, is this something I really need in my body? And start desensitizing yourself to stressors. So things that used to bother you, you can look at now and go, you know what? Not worth my energy. Before I had children, I used to be much more obsessive about having flat surfaces completely clean. We had a word for it. It was flat surface-itis. Swelling of the flat surfaces made me a little bit stressed. Once I had children, that kind of went away because I prioritized. I'm like, I'd rather spend my energy focusing on my children than draining my energy getting stressed out about the fact that there's 3 stacks of papers on the counter. I became much more mindful and aware of what I was choosing to allow myself to get stressed over. Reduce overprocessed foods like white breads, white sugars, pastas, non-whole grain pastas that spike your blood sugar. That's important too. Obviously, a healthy diet can help. And reduce excess stimulants. Caffeine, nicotine, even decongestants, anything that's a stimulant is going to trigger that stress response and going to cause some level of blood sugar secretion. Cortisol, our stress hormone, impacts all the other hormones. Hormones impact the availability of neurotransmitters. Relaxation hormones like GABA are known to help reduce inflammation. One of the things that's triggered when people take muscle relaxants is GABA. And that's partly because it helps relax the muscles, but it also helps reduce inflammation. Neurotransmitters, as I've mentioned before, work as a unit with hormones. As you increase calming neurotransmitters, you're going to increase your hormone balance, reduce your blood sugar, and improve your cortisol response. Strategies to balance your neurotransmitters. Eat a healthy diet. Your body makes neurotransmitters from the foods that you eat. So if you're eating crap, it doesn't have the materials it needs to make the neurotransmitters. Aromatherapy has been shown to increase neurotransmitter availability, increase serotonin, increase dopamine, even increase norepinephrine for focus. Meditation is wonderful. Open awareness meditation or focused meditation, any kind of meditation, can really help you become more aware of where you are in the moment and what is in the moment. And that can help you refocus your energy and step back and take a look at, when you finish meditating, you can ask yourself, now, how am I going to use my energy to move forward toward my rich and meaningful life? Now that I've regrouped. And simple mindfulness, checking in with yourself periodically throughout the day. How do I feel? What are my needs? What is the best use of my energy right now to move toward my rich and meaningful life? Gut health, dysbiosis, or an imbalance in the gut microbes, makes it difficult for the gut to break down food in order to make neurotransmitters and hormones. We all know when we've had food poisoning or something, and sometimes food comes out like whole, and you're going, what was the point of eating that? But anyway, sorry for the graphic imagery. But it's important to understand that when our gut is out of balance, no matter how well we eat, no matter how nutritious the food, if our gut can't effectively use it, then we might as well not have eaten it at all. Dysbiosis, an imbalance in the gut, causes the vagus nerve to send stress signals to the brain, which triggers the stress response, inflammation, cortisol, etc. This leads to increased inflammation, which can cause leaky gut. As our inflammation goes up, our hormones become more imbalanced, and the mucus lining on the gut actually becomes thinner, and the junction between the cells of the gut become looser, so toxins can seep into our system, including our brain, and we start seeing increased systemic inflammation and neuroinflammation. How do we improve our gut health? Well, probiotics like yogurts can be very helpful. Prebiotics, these are generally fibers that when you eat them, go down and they feed the bacteria in the gut. Inulin is a prebiotic that's very common. You can find it in chicory and a few other things. Stress management. Well, if you're stressed, you have a whole different environment in your gut than when you're relaxed. And that environment is not hospitable to the good bacteria. So we need to manage stress. Ideally, no alcohol or minimal alcohol. Avoid antibiotics when at all possible. Antibiotics are not discerning. They don't see, oh, there's this streptococcus. I need to go reduce the amount of streptococcus in the gut. No, they're gram positive or gram negative or just broad spectrum. So they kill half or all of the bacteria in your gut. And you basically have to start over again. They've shown in studies that people, after they take antibiotics, 6 months later, their microbiome is still not the same. And eat an anti-inflammatory diet. These diets are rich in fruits, vegetables, colorful foods, terpenes that are all wonderful. Additionally, fruits and vegetables have those soluble fibers that act as prebiotics and can feed the gut microbiome. In terms of managing energy, helping people recognize that addiction withdrawal, pain, inflammation from anything can lead to neurotransmitter imbalances, activation of the sympathetic nervous system. It will likely impair sleep because how many of us sleep well when we're in pain and have inflammation? And it just drains your energy. Even if you were sleeping well, it takes a lot of energy. It feels like you are walking into a gale force wind because your body's using so much energy trying to rebalance itself. Lack of energy causes lack of movement for most of us and circadian rhythm disruptions because you get out of your routine. You're not up and cleaning the house or going to work or working in the garden. You're sitting on the couch watching Netflix. And the body's like, okay, we usually do that 2 hours before bed, but you're not moving. So are we supposed to be awake or asleep or what's going on? We need to have movement to as much as possible to try to avoid circadian rhythm disruptions. Now, if you are bedbound, that's fine. That means wake up and do something. Sit up, laying flat on your bed 24 hours a day, 7 days a week. It's exhausting. I was on bed rest with my daughter. I know what I'm talking about. So it is exhausting because your circadian rhythms just go, you're in bed. Aren't we supposed to be sleeping? But like I said, if you are bedbound for some reason, increase the light levels and sit up as much as you can and engage in routines that you can engage in while still being bedbound. Lack of energy causes depression. Well, when we're fatigued, we can feel very hopeless. It's like, oh, I'm never gonna feel like I can get through the day. It can cause guilt because we feel like we should be doing things that we're not doing. And it can cause anxiety because we're afraid people are going to reject us or be angry with us, or maybe we're afraid that it's never going to get any better. And all of that is draining. Guilt is anger itself. Anxiety is, worry, anxiety. Both of those are, extreme energy sucks. And we don't want to dwell on guilt and anxiety. When we have that feeling, we acknowledge it and say, okay, I'm feeling guilty. I'm having this feeling that I'm guilty about something. What am I going to do with that? Interventions for energy, gradual reconditioning. If all you can do is sit up for 2 or 3 minutes, well, great. You sat up for 2 or 3 minutes. Now, maybe tomorrow, try to sit up for 4 minutes, but do it gradually. When I was recovering after surgery the last time, going out and working in the garden for 30 minutes the first day. Come back in the next day if I felt okay. Do an hour the next time. The next day if I still felt okay. And I was supposed to increase it by half an hour each time. Now, I'll be honest. Of course, I didn't do that. I went out there full force the first day and ended up re-injuring myself. But that's why you're supposed to do it gradually. Do as I say, not as I do. Manage your circadian rhythms, because that'll help you improve sleep quality, and that will help you have more energy. When you don't get quality sleep, you don't clear out the adenosine in your brain, which means you're going to have sleep pressure all day long. And be mindful of your energy expenditure and choose to use your energy, your physical energy, your emotional energy, your mental energy. Choose to use your energy to move toward things in those areas of your life that are important. Pain levels, none of us likes to be in pain, and it's frustrating. When we're frustrated, that's a stressor. We're increasing stress, increasing inflammation, throwing everything out of whack. Addiction withdrawal can be painful due to changes in the availability of endorphins, our internal opioids, and muscle tension. Chronic illness can increase pain due to the illness itself and possibly muscle tension. When my back is acting up, I will guard, so I end up with muscle tension, aches and pains in these weird places. But it's real, and the muscle tension causes pain, which impacts sleep. In terms of interventions, guided imagery, and I have a video on pain management techniques that goes into each one of these in depth. Guided imagery, using an altered focus. If I've got pain in my back, then I'm going to put my hand on something like my little kitty here who's nice and warm, and I'm going to focus on what that feels like. So I'm not thinking about my back. I'm thinking about my kitty. Massage, ice, heat, just acceptance and living in the and. I can have pain in my back, or I can have this going on and do something to use my energy to move toward my rich and meaningful life. Sitting here being angry over the fact that I've got pain is using that energy that I could be using toward something important. And practice good ergonomics. When we don't sit well, when we don't sleep well, sleep in good ergonomic positions, we have pain. You have stiff necks, you have, things feel out of whack. Pay attention to your ergonomics in the car, on the couch, at dinner, at the desk, wherever you spend more than a few minutes each day, to make sure that you are not contributing to your own pain and inflammation. Addiction and chronic illnesses both cause stress and inflammation and can be caused by stress and inflammation. Reducing stress and inflammation can help conserve energy that can be redirected toward the things that are important in your rich and meaningful life. Are there any questions? I hope you have a good session. If you're still with us, Lisa, always great to see you. And of course, I understand that sometimes you just got to go. That's funny, Ross. Left, right, left. That's right. One foot in front of the other. And sometimes that's all we can do. Progress, not perfection. I may want to do this today, but you know what? I may only have the energy to do this. And if you're not watching the video, I made a smaller segment. That's okay. Baby steps, because every little baby step is going to move us closer to our rich and meaningful life. Ross, I would encourage you to look into the Job Accommodation Network. I believe it's askjan.org. And it has a variety of suggestions that employers can consider when you have a disability, and they're for reasonable accommodations. Based on whatever your diagnosis is, you might be able to go into Ask Jan and find some reasonable accommodations and demand or strongly encourage them to consider letting you access them, because we are required to make reasonable accommodations. Everybody, thank you so much for being here today, and I will see you next Monday when we do our live Q&A.